Hey, it's Sharice. You can call me Cher, and you are watching the Style and Stewardship podcast, or you're listening to it. So this is episode 95, and this is, I believe, the fourth or the fifth video that I am doing in something that has basically become a series that I never intended because I'm experiencing something I could have never known that I was going to experience, which is, I'm going to get into that. So if you haven't watched any of the other videos, be sure to go back and watch the first one. I'll put it on the screen here, but I'll also put it in the description. So back in January of this year, 2025, I experienced facial paralysis. We went to the ER. I'm not going to get into all of that because you can find that on the very first one. And that's all about Bells Palsy. So what I wanted to get into today, I went to the neurologist last week, and you know, when you go to a specialist, you have to wait. So I wanted to actually wait until I got confirmation of my suspicions before I even shared that online, because I don't want to tell you something that I think without the confirmation of something official when it comes to something like this, especially if you're looking for answers and you're trying to figure out what's going on in your body, and you're like, what is happening? And maybe you are someone who has experienced Bell's palsy and you're like, hey, something still isn't right. So I wanted to share this, as well as just some updates on things that I'm still experiencing, things that I may experience for a longer road in front of me than maybe I had anticipated. I'm not really sure what I anticipated, honestly. I'm taking this day by day, as I'm sure you are. So the first thing that I want to get into is I was misdiagnosed. So this wasn't something that necessarily would have been caught immediately because of the onset of symptoms and how it is different than just Bell's palsy. So when I went to the neurologist this past week, I told her everything that I was experiencing, and I also told her I have a pain and I have this other thing going on, I'll get into that in a minute, where I just feel like this is more than Bell's palsy. And I've been doing a lot of research, and I think that this might be Ramsay Hunt Syndrome. And I'll go ahead and cut to the chase. That is what the neurologist actually diagnosed me as. The ER diagnosed me as an upper respiratory infection that turned into Bell's palsy. And before that, the immediate care said it was just an ear infection. So I wanted to share that kind of journey with you so that I can share this with you now, of the fact that that's not my diagnosis. And they are similar, which is why many people who have Ramsay Hunt Syndrome that may not even be aware of it, is because it affects the same nerves. But Ramsay Hunt Syndrome is much more complicated. So the reason why it's complicated is because Bell's palsy only impacts one facial nerve, one cranial nerve that leads to the face. And that's going to cause those symptoms of paralysis. Ramsay Hunt Syndrome, on the other hand, though Bell's palsy doesn't have one specific cause, one specific reason why people end up with it, Ramsay Hunt does. So Ramsay Hunt Syndrome typically is from a latent virus in your body, specifically chickenpox, which can then turn into shingles. And that is actually what I was diagnosed as being the cause of my Ramsay Hunt Syndrome, and not Bell's palsy. So it may still be called Bell's palsy or facial palsy because it impacts the same nerves that Bell's palsy does. However, Bell's palsy does not have the same complications that Ramsay Hunt Syndrome does. So they are like parallel in that they cause paralysis to one specific side of the face. So that is what I've experienced, and that's what I'm going through as we speak. However, the difference is Ramsay Hunt Syndrome has an excruciating pain that comes along with it, though Bell's palsy has less severity when it comes with pain, even though it can still be accompanied by pain. It's also caused by, just a virus that's going around, or it can be caused by, from what I understand, it can be caused by so many different things. But it is temporary facial paralysis, especially if it is addressed within the first 72 hours, which both of these conditions have in common. And they are treated the same way, which is why Even when I suspected I had Ramsay Hunt Syndrome, I didn't immediately go back to the doctor and say, hey, I need to get a different diagnosis so we can treat this differently, because they're actually treated in the same manner. So you're giving steroids, which is usually prednisone or some type, to reduce inflammation, which will then reduce the amount of the nerve damage that happens with both Bell's palsy and Ramsay Hunt Syndrome. The other thing is you will also be given some sort of antiviral, and they do that so that they can, just mitigate the issue that a virus may be causing or impacting the Bell's palsy or Ramsay Hunt Syndrome, because they're both caused by, they believe both are caused by a virus. The difference is Bell's palsy isn't usually a specific virus. So an upper respiratory infection is a virus. The common cold is a virus. So all of those things, and they don't really know, from everything that I've been told and everything I've researched from the medical professionals, they don't exactly know what caused it. That's even what I was told when I went to the emergency room, that it could have been caused by a throat infection, it could have been caused by an ear infection, and then when I look at my paperwork, they say upper respiratory infection, which this is your upper respiratory tract, so that makes sense. So Ramsay Hunt, on the other hand, is a lot more complicated, and what the neurologist said to me was Bell's palsy is basically really cut and dry. It doesn't last very long. Pain isn't super significant or as long lasting, and it only impacts that one facial nerve, which is the seventh cranial nerve that controls the motor functions on the impacted side of the face. However, Ramsay Hunt Syndrome affects more nerves, which is why it's accompanied by a lot more pain. And it is also accompanied by the fact that it is going to take longer for most people to heal from it, because there's more significant damage, which that all makes sense to me. And if you are someone who is experiencing Bell's palsy or some sort of facial palsy, and you're still experiencing something, be sure that you're really taking care of yourself, allowing yourself to rest, because nerve damage really does take quite a long time to heal. And depending on where you're already starting in your wellness journey or just in your health and what you're exposed to, is going to impact how much this is going to, how long it's going to take for you to heal. I am not an expert. Be sure to seek a neurologist, a doctor, get consistent checkups with it, especially if you're having any other issues that are accompanying any other symptoms that are accompanying the issue that you have. The other thing that the doctor told me was the way that I've approached it is literally, she said, it's the best that you can do. She said back in the day when she first started and got into this, like 20 years ago, when she became a neurologist, she told me point blank, they used to hook people up to TENS units. She said, we don't do that anymore. And then she leaned into me and she said, we don't do that anymore. And that's not something that I've shared in the other video on how I'm healing with Bell's palsy, when that is what I was diagnosed with at the beginning. And that's something that I knew I didn't want to do, because I don't want to just cause I don't want to force my healing. I want to support my healing. And that is my encouragement to you. It's so easy to get into this place where we want things to be normal, and we want things to go back to, that caused the shooting pain. We want things to be the way that they were. But you know how they say the definition of insanity is doing the same thing and expecting a different result. I think the definition of torment is looking at what things were as opposed to what they are now. So if you're looking at old pictures of yourself or old videos of yourself or anything like that, and you're saying, oh, I wish my face looked like that, or I wish I had my full smile, or any of those things, then you're just tormenting yourself. And I just want to encourage you to compare your progress to what is progressing. So if you have some pictures that you took right before you were diagnosed with Ramsay Hunt Syndrome or Bell's palsy, and you're having this facial paralysis, compare yourself to when you first started having your symptoms. Compare yourself now to when you were first experiencing the worst of things, or having this, the most stiffness in your face or the most paralysis. Because if you're comparing yourself to what you were before, you're in a different place now. It would be like a woman comparing her body to what it looked like before she had children. You are now in a different place. We go through different stages in our lives. We go through different just fluctuations and ebbs and flows, and such is life. So I just want to encourage you with that piece specifically. Don't torment yourself wanting things to be exactly the way that they were before. And even aging, right? We get older and we get more, gray hairs. And I always say all of mine are named after my son. I love him dearly. Those are facts. Our bodies are not going to be exactly the same. And that is one of the reasons why I'm so passionate about holistic nutrition and a holistic lifestyle, is because the more you can support things that are naturally going to happen anyways, like the healing process in your body, the aging, and your longevity, and all of those things, and how good you can feel on a day-to-day basis in spite of symptoms you have, in spite of diagnoses you may have received, then that's really the point of it, right? It's about optimizing where we are right now. So if you can, move something in your face that you couldn't move when this first happened, like, praise God, thank you, Jesus, then you are progressing. You are moving forward. So I wanted to say that because I've seen other videos other people have had. I've read every single last comment left on all of my videos. And one of the common themes is, there are people that are experiencing long symptoms, and they're chronic, seemingly chronic, with all of the things that are going on with their diagnosis. And as much as we would like things to just revert back to the way that they were, let's take what we have today and the grace that God has given us for today. And I pray that you know Jesus, and I pray that you are able to lean on him and dig into your word and find encouragement, and having people around you praying for you. I am praying for you. Everyone that watches these videos, I pray before I put them out, and I'm like, God, please help this to bless someone, to give them answers, to give them encouragement, and ultimately to point them to you. Because I am not the great physician. Doctors are not, even though there are great physicians, they are not the great physician, right? They didn't make the human body. So all the things that we even think that doctors know, or that doctors know, or, or the things that we've researched, ultimately, nobody has all the answers except for God. No one knows your exact healing time except for God. However, we can be good stewards over the things that we do know, and the things that we are confronted with, and how we approach those things. Because we can be down in the dumps about it and be depressed about it. And don't get me wrong, I've had moments where I was like, I just celebrated my birthday. Thank you, God, for another year. And this is not the way that I thought that it would be. My face looks so different than what it once did. And I'm going to get into some of the things and the symptoms that I'm still experiencing now, and some of the things that, I don't know, there may even be a surgery in my future. I don't know. But I will say this, I trust God with everything that he's allowing me to experience. And I always, I'm always encouraged by there's nothing that happens in a vacuum, right? There's nothing that happens to you that can't be something impactful and helpful, or encouraging, or edifying to other people. So there's this Christian artist that I love. His name is Tadashi, and he had this. My husband did this like Bible study for men a couple of years back, and one of the things that he said in the devotional was, "Don't waste your season." And I love that, and that has stayed with me. Like, I have chills on the back of my head when I say that, because you can be in a season right now that is just that. It is just a season, right? Seasons change. And if you stay in that season and you don't get something from it, then it's a wasted season. And that's something that, I'm speaking to me, but maybe I'm speaking to one of you out there too. I don't want to waste this. So my goal was never, I'm going to get on here and I'm just going to encourage people. It was, oh my gosh, this thing that happened, and I was I didn't know what the heck to think or what to do. And my husband said to me, you know, like, you can let Bells Palsy, well, Ramsay Hunt, now we know that that's what it is, paralyze more than just your face if you don't keep going. And this is a channel about, you know, inspiration and edification and just really wanting to encourage you in stewarding your health and your wellness. And, you know, that's what I'm here to do, with or without a diagnosis or symptoms, right? This is God's using this, and that is my prayer. And I didn't know that this would last as long as it has, but I also wanted to update you. So speaking of updates, let's get into just some of the things that I am still experiencing. And since this is Ramsay Hunt Syndrome, there are some things that may last longer than I assumed they would. So first I want to get into what clued me in that this was more than Bell's palsy and that this was Ramsay Hunt Syndrome. Okay, so the first thing that clued me into this being something more than Bell's palsy, not that that's not hard too, right? But the thing that clued me in was the pain. And when I was first experiencing this, and after I went to the immediate care, I got on 2 different calls with like a telehealth doctor. And the first one told me, you know, with the things that you're experiencing, I'm going to call in an antiviral that you can take on top of the antibiotic that the immediate care gave you, because this is Bell's palsy. The next day, when I could move even less of my face and could not close my eye whatsoever, and all of those things, the second telehealth doctor told me point blank, it is inappropriate for me to diagnose this with technology. You need to go to the ER right now, because the symptoms that you're experiencing aren't necessarily consistent with Bell's palsy. That's what he told me, because if you've been here before, I like words. I use a great deal of them, and I gave him all the explanation that I possibly could with the experience that I was going through, and describing it all to him. And he said, you have more than just one cranial nerve that can be impacted, and Bell's palsy, he was basically saying you need to go. He said, not basically, he said you need to go to the ER right now. So I got off the phone, I got dressed, and it was a Saturday, and my husband and my kid, we went to the ER and spent a couple of hours there. And that's when I was, you know, given the stroke protocol and all of those things. But the thing that I even said to them, should it hurt this bad? You know, like, does Bell's palsy hurt? And they're like, yeah, it hurts and things like that. And the amount of pain that I experienced, I just thought this has got to be more. So progressing, my right ear, so that's what we're going to talk about. My right ear, if anything came near my right ear, I mean, if even just a piece of my hair touched my ear, it would send a searing, shooting, electrical pain through my ear. And I'm not even talking about the pain that I experienced on the back of my skull. That was still present, but specifically just on the outside, I couldn't even touch the outside of my ear whatsoever. I couldn't put a Q-tip in it. I could not touch it. It hurt so bad. And I started to develop, and I even shared this, I think, in the first or the second video. I started to develop like something inside my ear. And I showed my husband, and I was like, is there something inside my ear? Because it's kind of hard to, you know, just do this and look in a mirror. And he was like, yeah, it's kind of like spots in your ear. So that progressed until it was like scabbing almost, as though it was bleeding, and it didn't bleed, but it was scabbing. And I was like, what is going on with my ear? And I couldn't sleep on that side of my face. I still can't sleep on that side of my face. And I just thought something's going on with my ear. So I started taking pictures. If you are grossed out by stuff like this, now is the time to fast forward because I'm going to share some pictures of what my ear looked like and what it looks like now. And one of the things that comes with this, since it is a shingles virus that has been reactivated, or chickenpox, I had chickenpox growing up, that turns into shingles that can literally lay dormant in your nerves, specifically in your ear. Everyone with Ramsay Hunt syndrome, I was told, doesn't necessarily have a rash, but if you do, it is like a telltale sign that this is Ramsay Hunt syndrome and not Bell's palsy. Also, some of the other things that you can experience is vertigo, being off balance, dizziness, because of all of the different nerves that it impacts. And anything that messes with your ears is going to mess with your balance. So I'm gonna go ahead and show you what my ear looks like now. You can see. So that is what my ear looks like now, and that is a huge sign that I probably had shingles in my ear. And everyone does not get a rash, is what I was told by the neurologist, and that is what that's what I've looked at when I've researched it for myself on medical journals online. Everyone doesn't get a rash, and sometimes it's in the inner ear where you can't even see it on the outside. So apparently that is what happened with me, and that is what is, as far as my diagnosis, what caused it, and that is why when, being on the antiviral, the steroid, and the antibiotic were so important, and to do that immediately, because since it is a reactivation of a virus, you want to kill the virus, right? So that is why, even if you are impacted by Bell's palsy or Ramsay Hunt, they take the same measures when it comes to what's going to help. So some of the other things that I'm experiencing, this is my smile. Let me show you some updates. So we've got some creasing here. It's not totally symmetrical. But that is my smile. I can kind of move this nostril on my nose. So I went to the ophthalmologist last week, and just to make sure that my eyes are okay, because this one still can't blink. And the top wants to blink. However, the lower lid does not move. And if I press my eye or try to lift up my lower lid, it shoots a really, really bad pain, like a migraine on just one side of my temple. It's not fun. So I try not to mess with it too much. I still do the same things as far as covering my eye and things like that at night. That is one of the most important things to take care of when it comes to Ramsay Hunt syndrome, because thankfully, thank God, the pain has gone. I still experience it here and there, but your eye is so important. The ophthalmologist told me this is so important. He's like, you're doing everything that you can do, and it is, keeping this eye wet. You want to keep it moisturized. I use the TheraTears brand. It's really, really great. And at night I use a gel, which is thicker. And there are certain things I still don't do. Like, I don't mess with my eyes at all. Like, I don't have any makeup on my eyelashes. I did like a little bit of that. But there's no like mascara. I still don't go near mascara or eyeliners or things like that. I don't want to mess with my eye. I don't want anything stuck in my eye that I can't blink out, because I can't blink. So I just leave it alone. And when I wash my face, I have to hold it down and kind of do that. It's interesting, but I'm kind of used to it at this point. And the other thing that Ramsay Hunt syndrome does is it impacts the ocular nerve. It impacts the nerve to your nose. It impacts the nerve to your lips, tongue, throat, ear. So where Bell's palsy, the recovery is quicker because it's less complicated and it only impacts one nerve. Apparently Ramsay Hunt can impact 3 to like 5 nerves. I won't get into all the science or anything with that. I can share that on a different video. Right now, this is more of an update and helping you to kind of see if any of these symptoms match yours, so that you can go back to your provider or go to a specialist and see what needs to be done. The other thing that's really, really important is to go to an ophthalmologist so that they can look at your eye and make sure that it is still healthy. Thank God my eyes are healthy. However, I was told that in the next couple of months, if I don't have any improvements when it comes to blinking my eye, surgery might be in my future. I don't know. That is something I I'll see how things heal and see how things go. And I'm just taking that to God and asking God for his wisdom in all things, but in how to address my healing going forward. I don't want to force anything. And if it's just going to take a while for my body to do it, then, that's what I want. The other things that I'm experiencing are lack of taste on the right side with the impacted side. I can't taste anything over here. It tastes like, when you go to the dentist and your tongue is kind of still waking up, where you almost feel like you could chew your tongue if you're not careful. That's what it's like on the right side of my mouth. And it's numb, but it's also, I can taste salt pretty well, but there's certain flavors that I really can't taste on the right side of my tongue. And I'm a foodie, so thank God I can still taste on the left side. You know what I mean? So really excited about that. The other thing is when I smile, I don't know if you can see this, but my lip, this is doing what it's doing. I don't know what else to say. But my eyebrows, they're pretty much lifting up in the same manner. And I can look, side to side, up and down, and all of those things. But this eye gets really, really fatigued, and going out in the sun is difficult. You know what I'm talking about if you have this experience, because I can't I can't drive without having sunglasses on. Just playing outside with my son, I definitely have to have some sunglasses on because I can't blink. And when dust gets kicked up and all of those things, you just want to protect your eye. The other thing that I was told by the ophthalmologist is not only do I want to make sure that it's wet, you want to make sure that it stays wet, but you also want to make sure that when you're sleeping, you're still covering your eye. And that's something I haven't stopped doing because this one doesn't close completely. This is the most that it closes. And that is because my lower lid does not move whatsoever. Even though my upper lid wants to move, my lower lid does not. So because of that, I still make sure to cover my eyes completely at night. And he told me you don't want to, sleep directly under a vent. If you can help it. If you can't help it, you can't help it, right? I can't move my bed. I still sleep underneath a vent, but my eyes are covered at night. But he said that dust can still get into the eye. So I may go back to taping this one shut with medical tape at night. We'll see. I bought some new, they're kind of like goggles that I'm wearing to bed, but they're soft. So I just got those in the mail yesterday. I'm really excited about that. That is what is going on with my diagnosis and with my proper diagnosis. And not that the people before were wrong necessarily. This was something that was still progressing, and we caught this thankfully in the beginning of this occurring in my body. So it's not that they were necessarily wrong, because it did still cause the same thing that Bells Palsy causes, but it was just and is more complicated. So if you are someone who has experienced this, if you've ever experienced Ramsay Hunt before, I actually alluded to the fact that I thought that this was Ramsay Hunt in one of my comments on my other videos. Someone actually commented that they thought that this was Ramsay Hunt, and I told them I was just telling my husband the same thing. But this is something that I've kind of thought for a while, but I was waiting until I got an official diagnosis and went to the neurologist that I was waiting for that appointment for. And I just want to encourage you to take this one day at a time. Focus on the foundations of what makes our bodies healthy by giving it what it needs to do what God created it to do, which is to heal. Everybody's healing journey is going to look different. Everyone with the same diagnosis even is going to have a different experience with it. So keep that in mind as well. Everyone heals at a different rate because everyone is impacted in a different way, because our bodies are so unique. And our experiences, our environment, our stress levels, all of those things are so different. But if you have any specific questions, I can do another follow-up video. If you want to continue to follow on this journey with me, because you are on it as well, I am praying for you. If you have any questions, leave them in the comments below, and I will be sure to answer them as I can. I'm still sharing all the other content that I love to share on this channel, which is all the health and wellness and holistic favorites, and all of the things that I absolutely love to encourage people with and empower them with on their own unique health and wellness journey. So those are still coming. Grocery hauls, things that I'm eating, because I still think that it's really important to focus on the foundations and not so much try to force your body to heal, but actually give your body what it needs or what it may be lacking or not getting enough of, by really honing in on what the human body needs. If you want any help from me, if you want me to walk alongside you, I would love to do that. I have a one-on-one program. You can click the link in the description below and you can apply to have a phone call with me. The phone call is free and we can just see if we're a good fit going forward. If this is something that you're interested in, be sure to click that below. But until next time, your life matters. What you do with it matters. So what will you steward well? Peace.